So Keir Starmer reacting there to the latest reshuffle plans. We can hopefully take you to the Commons, where the Health Secretary, Steve Barclay, is about to make a statement on the inquiry into the Countess of Chester Hospital. Let's listen in.
I think the whole House will agree it's right that she spends the rest of her life behind bars. I cannot begin to imagine the hurt and suffering these families went through. And I know from my conversations with them last week, the trial brought these emotions back to the surface. And concerningly, they were exacerbated by the fact the families discovered new information about these events concerning their children during the course of the trial. Losing a child is the greatest sorrow any parent can experience. I'm sure the victims' families have been in the thoughts and prayers of members across the House, as they have been in mine. We have a duty to get them the answers they deserve, to hold people to account, and to make sure lessons are learned. That's why, on the day of conviction, I ordered an independent inquiry into the events at the Countess of Chester Hospital, making clear the victims' families would shape this. I arranged with the police liaison officers to meet these families at the earliest possible opportunity to discuss with them the options for the form the inquiry should take. And it was clear their wishes were for a statutory inquiry with the power to compel witnesses to give evidence under oath. And that's why I am confirming this to the House today. This inquiry will examine the case's wider circumstances, including the Trust's response to clinicians who raised the alarm and the conduct of the wider NHS and its regulators. And I can confirm to the House that Lady Justice Thirlwall will lead this inquiry. She is one of the country's most senior judges, currently sitting in the Court of Appeal, and with many years of experience as a senior judge and a senior barrister before that. Before making this statement, I informed the victim families of her appointment, which was made following conversations with the Lord Chief Justice, the Lord Chancellor and the Attorney General. I have raised with Lady Justice Thirlwall that the family should work with her to shape the terms of reference. We hope to finalise these in the next couple of weeks so the inquiry can start the consultation as soon as possible. I have also discussed with Lady Justice Thirlwall the family's desire for the inquiry to take place in phases, so it provides answers to vital questions as soon as possible. I will update the House when these terms of reference are agreed and continue to engage with the families. Today, Mr. Speaker, I would also like to update the House on actions already taken to improve patient safety and identify warning signs more quickly, as well as action already underway to strengthen this further. First, in 2018, NHS England appointed Dr. Aidan Fowler as the first National Director of Patient Safety. He worked with the NHS to publish their first patient safety strategy in 2019, creating several national programmes, including requiring NHS organisations to employ dedicated patient safety specialists, ensuring all staff receive robust patient safety training, and using data to quickly recognise risks to patient safety. Last summer, to enhance patient safety further, I appointed Dr. Henrietta Hughes, a practising GP, as England's first Patient Safety Commissioner for Medicines and Medical Devices. Dr. Hughes brings leaders together to amplify patients' concerns throughout the health system. Second, in 2019, the NHS began introducing medical examiners across England and Wales to independently scrutinise deaths not investigated by a coroner. These senior doctors also reached out to bereaved families and find out if they have any concerns. All acute trusts have appointed medical examiners who now scrutinise hospital deaths and raise any concerns they have with the appropriate authorities. Third, in 2016, the NHS introduced Freedom to Speak Up guardians to assist staff that want to speak up about their concerns. More than 900 local guardians now cover every NHS trust. Fourth, in 2018, Tom Clark KC was commissioned to make recommendations on the fit and proper person test for NHS board members. NHS England incorporated his review into the fit and proper person test framework published last month. This introduced additional background checks, consistent collection of directors' data, and a standardised reference system, preventing board members unfit to lead from moving between organisations. And finally, turning to maternity care. In 2018, NHS England launched the Maternity Safety Support Programme to ensure underperforming trusts receive assistance before serious issues arise. Also since 2018, the government has funded the National Perinatal Mortality Review Tool, which supports trusts and parents to understand why a baby has died and whether any lessons can be learned to save lives in the future. Furthermore, the government introduced the Maternity Investigations Programme through the Health Safety Investigations Branch, which investigates maternity safety incidents and provides reports to trusts and families. And in 2020, NHS England's Get It Right First Time programme expanded its cover to neonatal services. They reviewed England's neonatal services using detailed data and gave trusts individual improvement plans which they're working towards. Indeed, Professor Tim Briggs, who leads the NHS Get It Right First Time programme, has confirmed that all neonatal units have been reviewed by his programme since 2021. Let me now turn, Mr. Speaker, to our forward-facing work. We have already committed to moving medical examiners to a statutory basis and will table secondary legislation on this very shortly. This will ensure deaths not reviewed by a coroner or investigated in all medical settings, in particular extending coverage in primary care. And this will enter into force in April. Second, on the CARC review. At the time, the NHS actively considered CARC's recommendation 5 on disbarring senior managers, taking the view that introducing the wider changes he recommended in his review mitigated the need to accept this specific recommendation on disbarring. This point was also considered further by the Messenger review. In light of the evidence from Chester and ongoing variation in performance across trusts, I have asked NHS England to work with my department to revisit this. They will do so alongside the actions recommended by General Sir Gordon Messenger's review of leadership, on which the government has already accepted all 7 recommendations from the report dated June last year. This will ensure the right standards, support and training are in place for the public to have confidence that NHS boards have the skills and experience needed to provide safe, quality care. Third, by January, all trusts will have adopted a strengthened freedom to speak up policy. This national model policy will bring consistency to freedom to speak up across organisations providing NHS services, supporting staff to feel more confident to speak up and raise any concerns.
So that is the Health Secretary, Steve Barclay, updating the Commons on the inquiry following the conviction of former neonatal nurse Lucy Letby. He said it will examine the Trust's response to whistleblowers. It will look at the wider conduct of NHS managers. The inquiry will take place in phases and it will be headed up by Lady Justice Thirlwall. He also described a number of moves which have been made to improve patient safety. We will hear more about that inquiry, I'm sure, over the next few weeks.